all of you here, and my gratitude goes to Pratibha ji, who has invited me to share this platform with all of you who are doing wonderful job in IVF and ERT centers. I represent Goa Medical College, which is a state-run medical college in Goa. That's the only medical college which has in the country the IVF facility or ART center, which caters to everybody in the state as a Goan and gives the free treatment. The only medical college in the country which gives totally free treatment, means the couple with primary sterility can walk in, and I'll show you they have walked out with a child without paying a single rupee, or there's no out-of-pocket expenses. So how we do this and how we expanded the access to IVF in Goa Medical College, I would just share my policy decisions and my dream of Honorable Health Minister Sri Vishwajit Rane. He couldn't make it today because of some commitment. And my team members here, Dr. Kedar Padte, who is a technical expert in IVF, and Dr. Muriel Cardozo, who is HOD of Obstetrics in Goa Medical College. So moving further, through the medical college, we are trying to augment national health care through government medical colleges, which is, a newer concept that we are trying to push in, because most of the time people nowadays, the paradigm shift is not to go for any advanced treatment to the medical college, but on the contrary, people would prefer some kind of a corporate setup. But we have tried to do maximum national health and advanced healthcare facility in a government medical college of Goa. So we call it as a Goa model, and this is what I'm going to share with you today. As a social outreach programs, we have multiple programs, but one of them which have enlisted, which is not within the National Medical Commission, but we have enlisted, is ART and IVF. Now, infertility, as you know, is not just a medical condition. It is an emotional and social struggle that affects millions of couples in India. The stigma surrounding the childlessness often leads to isolation, distress, and even strained relationship, especially for the women. While IVF offers the hope, its high cost keeps it out of the reach of many people, and free IVF treatment programs are transformative step, and that the financial limitations do not stand in way of getting parenthood. These initiatives are not just about the medical interventions, they are also restoring the hope, dignity, and dream of the complete family. So the special perspectives is that the introduction of free IVF treatment is a groundbreaking step in Goa that has transformed many lives. Infertility is not just medical challenge, as I told you, and by making IVF accessible to all, regardless of financial status, this initiative will provide hope to the couples who have longed for child but couldn't afford the treatment. And it will ease the burden of infertility, reduce stigmata, and give families the opportunity to experience the joy of parenthood without financial hardship. So this is not just a healthcare reform, it is a step towards more inclusive and compassionate society. So it was not so easy for me to start IVF in government setup. As you know, government setup has multiple issues, and we call it as a red tapeism. Here is our leader, Honorable Health Minister, who had this idea in his mind, and with his team, we first started IVF in our super specialty block. So this is where is the IVF center that we have in our super specialty block. This is our super specialty block, which is harboring a lot of super specialties, but in one of the floors we have put our IVF center. can't see slides? This is the sorry, I didn't realize that. So this is our super specialty block where we have put our IVF center. I will be giving you a short video of walk through towards the last presentation. Now what are our milestones? We had an inauguration on 14th of August 23, and date of first IUI was on 12th March, and date of ovum pickup was on April 24. Total number of infertility patients registered at the center are 238 till date. Total number of patients who have undergone IVF are 47 till date, but those 47s are undergone 68 cycles, and the total number of IUI procedures 135 till date who have undergone 294 cycles. So in IUI we use 6 cycles as the uppermost limit. Our statistics is IVF cycles 68, ovum pickup 64, embryo transfer 57, frozen embryo also we have done in 4 cases, and IUI 294. This is the stats that we have at present. Our results are that we have total 14 pregnancies have achieved, and I am happy to tell you we have achieved this in a second cycle. Most of them are in second cycle, and 5 delivered live births, 5 ongoing pregnancies, 1 twin and 1 triplet, and there are 4 miscarriages. So our results are also pretty good. You can look at our stats. The results of IUI, 8 pregnancies achieved, 1 delivered live birth, 7 ongoing pregnancies. The cost of IUI per cycle approximately is 6,968 rupees, and this is borne by the institution, that is Goa Medical College, and cost of IVF cycle per cycle is 1,40,264. Again, this is borne by the institution Goa Medical College and the government of Goa. Now let us know what is the patient's perspective in IVF. This is our first IVF baby being delivered and struggling with infertility. This is what patients say: I couldn't afford an expensive IVF treatment. When I heard about free IVF in Goa Medical College Hospital, I was skeptical but hopeful. The process involved long waits, but the doctors were compassionate and care was good. After an emotional journey, my first cycle was successful and I was finally pregnant. These are the words of the patient who delivered our first IVF baby, and the chance of motherhood without financial burden. I am immensely grateful to Mr. Vishwajit Rane, Honorable Health Minister of Goa, the Goa Medical College doctors, and in particular Dr. Kedar Padte for making dream of motherhood come true. So this is what is the satisfaction, and this is the payment that we get from the patient. So this is a run through a video. Please play this video. I'll just give you the brief. This is just a short video.
भुरगे जर ना मनशाक जाल्यार खूब त्रास जाता जेन्ना आमी 4 बसता तेन्ना आमकां खाली पण येता आनी आमी ताका खातीर खूब ट्राय करता डॉक्टराडे वयता डॉक्टराडे वचून आमकां खुबसो खर्च जाता तो खर्च आमचे कडेन थोड्या
सफाई कर्मचारी at Goa Medical College
आमकां हांगा थंय नाचपाचें पडटा कमवपाचें पडटा
प्रायमरी स्टरलिटी
म्हणजे भुरग्यांक लागून खूब हांव हें करतलें म्हणजे डॉक्टर सुद्दां खूब केले पूण कांय फायदो जावंक ना त्रास खूब जाले म्हाका पयलीं आनी आतां थंयसर सुद्दां वचपाची म्हाजी परिस्थिती नासली तरी सुद्दां हांव गेलें भुरग्याक लागून म्हाका भुरगें जाय म्हणून.
You know, it is the right of every couple to have a child, and this has been a dream of our Honorable Health Minister, who has been asking us to start this facility of IUI and IVF. Now both these facilities will be covered in this ART center with the free of cost, totally free treatment, because if you see, these patients were referred to the centers where they had to pay through their nose. Sometimes they had to sell their ornaments to get a child. Now I am happy that we are tied up with Dr. Kedar Patte, who is a pioneer in this ART technologies, and he'll be hand-holding us, and our Honorable Health Minister Shri Vishwajit Rane has himself come out with the CSR activity, and this center will serve people of Goa for a long time, and I am happy that right to have child will be fulfilled at the end of the day.
खर्चा तो हिसाब नहीं, इतना पैसा डाला है कि बोल भी नहीं सकते हम बच्चे के लिए। अभी लास्ट ट्रीटमेंट में 7 लाख का खर्चा हुआ उधर। तो एक माँ पर क्या बीतती है, सब लोग तो ताने मारते थे, कभी रहेगा, इतना साल हो गया बच्चा नहीं है।
Patients who have an infertility problem, who are unable to conceive naturally, can approach us in OPD 24, that's the obstetrics and gynecology OPD. We are also happy that we have been able to procure the state-of-art equipment for our IVF center, and there has been no compromise on standards that have been maintained to start up this center.
We are now entering the sanctum sanctorum of any IVF unit. So this is the embryo transfer operation theatre, which is, as you can see, under the AHU or air handling unit. The purest of air is here. The operation theatre does not contain any fumes whatsoever. It has solely an ultrasound machine with the embryo transfer table. It is under HEPA filters, and we get the cleanest of air. This is the actual embryology lab, and if anyone walks in with the slightest of fumes or perfume also, the alarm will go off. You can see various incubators here, which are the embryo culture incubators. There is the ICSI apparatus with laser hatching facility for PGS or PGD, a laminar flow and a tabletop incubator, and a blastocyst culture incubator as well. The flooring is epoxy flooring. The air is at its cleanest with the best of HEPA filters, and that air itself is also filtered further with this ESCO workstation, which maintains uniform temperature of 37 degrees and cleanest possible air. These cryocans are very essential. They are in liquid, they carry the liquid nitrogen, which maintains the gamete at minus 196 degrees centigrade. The level of liquid nitrogen has to be persistently maintained lifelong. If at any given time the cryocan cracks, all the gametes have to be transferred into a jumbo cylinder where they can be preserved.
शादी होके 15 साल हो गया। 15 साल में इधर उधर बहुत दिखाया, मैं दवा करना इधर इधर बहुत दिखाया, लेकिन कुछ काम नहीं हो गया। बाद में इधर IVF का दवा करने में गया, तो वहाँ पे ट्रीटमेंट किए, तो पैसा भी बहुत खर्चा हो गया, और 5-6-7 लाख तो खर्चा हो गया अभी।
It has been a tough job for patients seeking IVF because of the costs involved, because of the cost of the drugs involved, and also because the success rates are not very high. However, our government has taken a fantastic initiative of setting up an IVF unit in the Goa Medical College, the first of its kind in the whole country, where free IVF treatment will be available to these couples who feel that they are hopelessly placed. And once a child is born, their emotions, their whole families, their entire socio-economic and personal backgrounds get bloomed into a different kind of world.
सुबह में जो मैं बच्चा हाथ में लिया तो बहुत खुशी महसूस हुई और बहुत रोया। मैं भी कोई खुशी का जाहिर नहीं कर सकता, मैं इतना खुशी है।
आमचे आरोग्य मंत्र्यान ही IVF हाडल्याबद्दल आमकां खूबसो फायदो जातलो तेजो, आमचे पयशे वाचतले।
विश्वजीत बाबान हे मशीन हांगा हाडलें GMCत म्हणून खूब बरें जालें, गरीब धट्यांक सगळ्यांक बरें पडटलें, म्हाकाय फायदो जालो। तसोच आतां हेजे फुडें कोण गरीब धट्टे आहा न्हू तांकांय बरो फायदो जातलो म्हणून विश्वजीत बाबाक हांव थँक्यू म्हणटा।
Many of our sisters who want to start a family used to have so much of problems running around from pillar to post, getting doctors' opinions and going for treatments for IVF, which we, with the inspiration of the Honorable Prime Minister Shri Narendra Modi ji and with the support of the Chief Minister, have been able to do this. Though we got all the funds from CSR, we got some few people who were passionate about the cause, what we wanted to take forward.
This is what we are doing at Goa. I think I overshooted the time. Thank you for patient listening. I'm here to take any questions if anybody has any questions. Yes.
You had mentioned it's a part of CSR.
Yes.
So is the, it's not from the Goa health, I mean it's a CSR activity of certain corporate, is it?
It is a CSR activity from our Honorable Health Minister himself.
Okay,
Yeah.
fair. No, not a corporate.
No, no
okay,
corporate
fair.
is involved here.
Thank you.
And the functioning is now through government funding.
Yeah, thanks for the information. I just want to know, is it who are the eligible couple to enroll in this?
We have one insurance scheme in Goa called as DDSSY, and the Goans who are citizens of state of Goa, they're eligible. Even if they show the election card, they become eligible. Not barring others also, but government also has a policy to give exemptions to people who are visiting Goa and they want to avail this facility. So this is evolving and this policy will evolve very soon.
Thank you.